Today we are joined by Dr. Kristin Dascomb, infectious disease physician here at Intermountain Healthcare, to give our weekly COVID-19 update to the community. Kristin, thank you so much for joining us. It's nice to see you.
Thank you for having me. I appreciate the invitation.
Of course. So as always, we're going to start with case trends and counts and what's been going on in the state. So I'm just going to read those out really quickly. So our total case counts for the state of Utah is at 388,909, with yesterday's daily case count at 483, which brings our positive rate to 7.1%. We had a total of 2,149 deaths in the state, with 10 of those reported yesterday. Right now, our hospitalizations stand at 138 people. And with vaccines, we have now given over 1.6 million vaccines, with 1 million of those being a first dose and 621,247 of those being fully vaccinated people. So let's break that down a little bit. Kristin, can you give us an overview of how our state is doing as far as these case counts and hospitalizations go?
Well, right now we're at about the place we were back in June. So we're not down to a good solid baseline. We still have CDC defined high or very high transmission. So we still have to be careful when we're out there. But it is looking optimistic as our case counts continue to decrease. We've been around 400 cases per day for a while now, so we may be flattening out or slowing our trend a little bit. So there's still a really good reason to keep masking and to stay safe.
And does the state, or do you have any concerns as to where we are with the state and the virus itself? I know you mentioned we're back to this June period. Is there any concern right now that we could potentially see a spike go up or anything of that sort? Are we doing pretty well as far as transmission goes?
Right now, we're doing pretty well. There's always that concern in the pit of a scientist's stomach that we have variants in the community. There are several, including the UK, that is the most prevalent in our area, that can become more dominant and are very much more transmissible in our community. As a consequence, we could see, like Michigan, a surge in the future if we aren't able to continue to vaccinate our population as well as we've been doing and keep safe. We need both of those pieces to do that. So while I do feel optimistic, I'm going to keep that optimism. There is that concern that we have to maintain our vigilance and keep going with our vaccinations to ensure that we stay safe over time.
And I know that you are actually someone who goes into our hospitals and are with our COVID patients and helping them get better. How are caregivers generally feeling about where we are in the pandemic right now? Is there a sense of relief as we move forward into the summer? How is everyone doing, including you?
Thank you. That's very kind to ask. I think a lot of our caregivers, and I was just on the ward this morning, a lot of our caregivers are feeling a sensation of relief. We have fewer COVID patients in the hospital. We're seeing more of our family and friends because we're vaccinated and we're still staying safe. We understand, while things are changing, we have that sensation of relief, mostly because we're not seeing our colleagues getting sick. We are seeing reductions in caregiver infections, and we're also seeing less patients. And so as a consequence, there's a real feeling of optimism. We're all seeing the signs of spring emerging. It's getting warmer. We're hearing the birds. We're starting to see the snow melt. I think all these sensations are coming at the same time with spring, along with this optimism. And I think as we continue, we can't lose that sense of concern as well, but we're really doing a lot better than we were just a few months ago.
That's good to hear. And I know it definitely helps for morale with our caregivers to see things moving in a positive direction, especially that aspect of their colleagues not getting sick. I think that's really important. That probably hits very, very close to home. So I appreciate that insight.
Yeah, it's also a good sign that the vaccine's working too, right?
Yes.
We were some of the first folks that got the vaccine. They didn't get sick from receiving the vaccine, and they're not getting sick as they continue to care for others. So it's a really good sign in many fronts.
That's great to hear. I want to switch gears a little bit to the mask mandate. The statewide mask mandate is ending tomorrow, April 10th, but Intermountain is going to be continuing our masking in our facilities. Can you tell us why it's so important for patients and caregivers when they come to our facilities to keep up with wearing a mask?
We still have 400 cases a day, and our caregivers take care of those who are sick. So we have an obligation to our visitors, to our patients, and to our caregivers to keep everyone in our hospital safe from disease transmission. We don't know all the time that whether someone is sick or not, or has just recently been sick, or if they just had been exposed and they don't even know. This illness is tricky and can have people transmit illness even when they have no symptoms at all. As a consequence, we will maintain our mask mandate within our facilities to protect our caregivers from infection, to protect our patients from infection, and those who visit our facilities for our laboratory, for visiting patients, for whatever it is, to really ensure everyone's safety while we still combat this virus.
And a lot of people too are thinking that once they get vaccinated, they don't have to wear a mask any longer. Why is it so important though that people continue to do this in public in the places that ask for it, even if they have been vaccinated? You mentioned our hospitals, but what about just in general?
Well, we have to start with the fact that not everybody's vaccinated yet. We've done really, really well with our elders. 75 to 80% of our 70s and older, 71% of our 60 to 69-year-olds. But the rest of us are still waiting to get vaccinated, so we can't assume everyone around us is vaccinated, even if we are. The second piece is that even if someone is vaccinated, there is a risk of transmitting the virus. It's extremely low, but it's still there. And so if you are in a business, you don't know if the people around you are vaccinated. And I personally wouldn't want to risk transmitting this virus to someone who is still susceptible. We don't know the immune status of the folks around us. We don't know if they've been vaccinated or if they have an illness that might make them extremely susceptible to severe disease. Just as a courtesy, I would definitely recommend continuing to observe those rules so that we can all be safe, even despite vaccination, until we can get this virus curbed a bit more.
I think that's really good advice, especially as you go into businesses that are still requiring it here in Utah. And if you're going elsewhere, I think it's important to just be mindful of those around you and respect those boundaries that they've put forth. Do you have any additional advice for those people too, as tomorrow gets here? If they want to continue to wear a mask, is there anything that they should do differently as far as that, or should it just kind of be continuing the norm until the science tells us otherwise?
I would say continue the norm. I think we've learned very well that masking works in our communities. It helps keep our businesses open. It helps us interact with our families safely. It helps us enjoy moments together safely. And so while we have these just a few more months of continuing transmission while we get that vaccine out to more folks, it is still a recommended practice to have masking in place. And if you have, as long as it works for you and you are able to maintain that, we should be able to keep those counts continuing down.
There's also been a lot of talk nationally about this fourth surge. You mentioned Michigan specifically. What are you seeing, and are there signs of any of this fourth surge potentially happening here in Utah?
We're watching for that carefully. We're watching those case counts on a daily basis. Michigan is fairly unique because they not only have a combination of a very large population that is not yet vaccinated. They had been in lockdown for a very long time, so they didn't have the surge that we did and don't have the infected and now antibody patients that we have. And they're just opening up just a little bit and have the B11 strain, that B117 strain that is the UK variant that can be more transmissible. And so all these combinations came together to allow them to have an increase in their viral transmission. This is ongoing also in Florida, where they're a bit more open than our state is. And so we have this concern in our own area that should we open up too soon and decrease masking mandates, for example, that we could have increasing transmission with some of these more transmissible variants before we get our populations vaccinated. We're not seeing evidence of that yet, but we're watching that very carefully, and we want to maintain our vigilance to prevent that kind of surge. We're also a place that has a lot of travelers coming into it all the time. They can certainly bring new strains into our communities. We don't know when that's going to happen. And so we really need to ensure that we are continuing while we learn how these are transmitted and make sure that we are addressing them as they come along.
There was a really great question just asked. Are we seeing any correlation between states lifting mask mandates and a potential surge happening in those states? I know there's a few states that completely lifted them a couple of weeks ago. Did we see any effect of that at all?
I have not reviewed that specifically, but in the past we certainly have. And Salt Lake County was an outstanding example of that in the past. When they instituted their mask mandate, their counts went down dramatically while the rest of the states continued to increase. There is definitely a direct correlation between mask mandates and maintenance of case counts or reductions in case counts. And so while I haven't reviewed those specific data recently, there is a lot of correlational data already that supports that statement.
Another question we just got asked is around stress. May is actually a mental health awareness month, so this is a great question in prelude to that. But does stress affect your immune response at all to the COVID-19 vaccine at all?
I don't think it impacts your response to the COVID-19 vaccine. Can it reduce your immune system a little bit in general? The answer is yes. Is it dramatic, as you would be concerned that you wouldn't respond to a vaccine? The answer is no. And I can say that very specifically related, let's say, to our caregivers, right? We vaccinate our caregivers first because they are they were experiencing a lot of stress. They were taking care of patients. They were overbooked on their shifts because they had to take care of a lot of patients and make up for those caregivers that were sick. They were under a tremendous amount of stress. They were vaccinated. Their numbers have gone down from across our system in the hundreds, now down to well below almost 12 a day. So we're looking at a lot fewer cases among our caregivers that demonstrating the efficacy of the vaccination despite stress in our communities.
That's great to hear. And I know I've seen people too who are very nervous about getting the vaccine just in general. They don't like needles, they don't love getting vaccines, etc. And there's been a lot of great suggestions of like listening to music when you get your vaccine so you're not paying attention, which I thought was interesting, or like distracting yourself. So that could probably also help with the actual stress of that portion of getting the vaccine too. So it's been interesting to see what people are doing to make themselves more comfortable to go get it. Which brings me to my next couple of questions for you around Utah specifically for the vaccine. So you mentioned earlier the percentages of, I think it was 65 and older getting the vaccine. How is the state doing outside of that, especially that younger demographic that became eligible a couple of weeks ago?
They're working on it is the answer. Utah is one of the best states in terms of getting vaccine out to its population. It's number 11 last I checked in terms of how well they're doing. And I will say they keep reevaluating their ability to do it better. So I give the state a lot of credit for really doing a great job getting that vaccine out, not only through their health departments, but also through their health partners, such as Intermountain and others that have helped work on this. In terms of like the 50-year-olds, the 40-year-olds, we're still only around the 40s and 50s percentages, but they keep going up. And I think that's the biggest message to send is that they are continuing to work on it. They're doing a great job in educating, targeting those that really need some more information about it, and continuing to get it out as quickly and efficiently as possible. And so the fact that they're continuing to increase is the most important part of it all.
It's also been around 4 months since the vaccine was first distributed here in Utah. What is the biggest thing we've learned since December around that? I know there's probably a lot.
There's lots, yes. The first thing is that there's not a lot of really big side effects associated with the vaccines that we've been delivering. We've been monitoring this exceptionally carefully, and we are really seeing, we do see the fevers and the red arms and things that are very temporary that eventually just quickly go away. But we really aren't seeing really big side effects that I think a lot of people were worried about. So that's the first thing. The second thing is we are seeing people having durable immunity. Pfizer just announced in their press release that we're having 6 months worth of immunity, which is a great finding. The third, I would say, is we're seeing case counts among specific groups that have been vaccinated decrease. We have fewer hospitalizations because we vaccinated our elder populations, And we're seeing fewer and fewer cases in our healthcare workers. Those groups that we have good, high proportions of vaccination coverage, we're seeing reductions in counts. And I think those are all extremely reassuring to those who haven't gotten it yet. And so I'm hopeful that we'll see some more in our younger population as well.
You mentioned that 6-month immunity piece. Will you just clarify what that means in terms of 6 months? I've seen people comment it's only 6 months, but it's not that it's only 6 months. It's that the clinical trials have been 6 months. Is that correct? Can you explain that more?
Absolutely, yes. Pfizer announced, and it's really just in a press release, so we have yet to see the data yet, and the FDA hasn't reviewed that. But in their own clinical trial data among their patients that they initially vaccinated, they now have data to demonstrate immunity out to 6 months. Likely, we'll see much more durable and extensions from that, but technically that's the only amount of time that they have recorded thus far. Which is still great. It's still wonderful to hear that we have that kind of durable immunity, knowing that we won't have to booster in a few months, so to speak. So it's a good, wonderful data.
And it's like you said, as we learn more, I'm sure they'll release more information for us. So that's
there will be more and more as time goes on. Absolutely.
Yes. I want to go back to the mask mandate really quickly, and then I have a few more questions around the vaccine. As a caregiver yourself, what is your reaction to counties not implementing mask mandates to replace the statewide one that ended on Saturday? Should there be a mask mandate in place right now at a state or county level? Do you have any thoughts around that specifically?
Intermountain specifically isn't as much involved in the politics of all of this. I can say from a scientific standpoint that we have really good evidence that mask mandates from governmental entities work to reduce case counts, to control virus in public spaces, and to maintain the health of the population. And so is it an advisable thing to do when transmission is still occurring? The answer is yes. But to pass judgment one way or the other is probably not my place. I will say that we will continue to do that in our businesses to maintain our patient safety and our caregiver safety as well.
Along those lines too, because the goal is to get to herd immunity, how close are we to actually getting there from a state perspective?
Well, in order to get to herd immunity, you need a fairly high percentage, somewhere in the neighborhood of 50 to 60 at least percent of people vaccinated. We have good percentages in our elder population because we did a great job of vaccinating them thus far. We're still working on our younger folks, and our kids, unfortunately, won't necessarily get vaccinated for a while. And they have the potential, especially our 15 to 24-year-olds, to really promote transmission to continue. In our early surge back in November to January, they were a large part of that continued surge, and that they won't be vaccinated probably as a group in a large part until later in the year. So we still have some time before we'll get some of our younger folks vaccinated, plus our younger kids aren't eligible yet. So we'll still have some work to do in the future before we really can achieve that level. But like I said, I think our state's doing a great job really working on that.
You mentioned that the adolescent population, some of them are not yet qualified. We are, though, seeing this uptick of cases in those specific groups. Is there anything this group can do to help combat that, or any advice you have for them going forward until they're eligible for the vaccine?
That's a hard group to reach, I have to admit. They're kids who want to be together. They perceive themselves as invincible, and that they won't get sick from this infection. My suggestion would be not just to think of yourself, because maybe you wouldn't get sick, but maybe your friend would, or maybe their grandmother would, or your grandmother, should you bring the virus home to your family. And so wearing your mask when you're with friends that aren't with your family, getting vaccinated as soon as you are eligible, and ensuring that you're safe around your friends. I know we're starting to get back together with family and small groups of friends now, but to make sure that we're really wearing our masks when we're in these groups, to ensure that we're not transmitting virus when we don't even know we have it is critically important to really helping that age group reduce their case counts and transmission.
And last question for you. What is the status of the variants here in Utah? I know you mentioned the B117, I do believe earlier, but will you give us a little bit more information on what those are circulating like in Utah and the nation as well?
So Utah does have the B117, and it is the most dominant strain across the country. It is the one that's causing, as we mentioned, Michigan and Florida, and then there are some California strains as well. They are a portion of our strains, about 40%, but they're not all of them. And the problem with our data currently is that it does take a lot longer for us to identify them. It takes about a week to sequence them and determine which one is which. And so we're a little behind on those data. It's hard to say exactly where we are, but we are a lot lower than the rest of the country in terms of those. Now, again, I mentioned that we are a great travel state. We're one of the most beautiful places in the country to come and visit, especially if you want to see nature at its finest. And so people are looking to that. They're going to start coming and traveling, seeing our national landmarks. We're going to have a lot more interaction with people from across the country that may bring those variants in. We'll still need to be vigilant to make sure that and continue to sequence those viruses to see if we have changes over time as we see more travel across the country.
Okay, piece of advice before everyone leaves. What would you say as we go into this weekend with the mask mandate ending and just things getting more opened up? Anything else you want to mention before we head off for today?
No, I think we're doing a great job. I think we need to give kudos to the state for doing a really great job in distribution of the vaccine. I think we need to give ourselves credit for really doing our masking the way we have, but despite the mask mandate lifting, I think we need to be respectful to businesses when they ask for masking, because it is still relevant both to their patrons who are coming in, but also their workers who are in the facilities. And we can transmit this virus without knowing we even have it in the back of our throats. So if we wear a mask, we don't know who else we're infecting. So please be respectful to those who ask for a mask to be worn so that we can still all be safe.
I think that's a great way to end. Kristin, thank you so much for joining us. I really appreciate all the questions and answers that you've given us today. And if you're interested in getting vaccinated for COVID-19, we release appointments every Friday at 8 a.m. You can go to intermountain.com/COVID vaccine. There is a schedule a vaccine appointment link on there that'll take you through a quick form that you have to fill out with your information. And then you can select a time and a location that works best for you. We also have our behavioral health navigation hotline, which used to be our emotional health relief hotline, still available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks again, Kristin, and we'll talk to you later.
Thank you so much.
Thanks.